Now, our final speaker for today, ladies and gentlemen, is Dr. Kashfi from KKH Women's and Children's Hospital. Dr. Kashfi is a pediatric intensivist with a special interest in neurocritical care. She's also a consultant at KK Women's and Children's Hospital. So, ladies and gentlemen, let's give her a big round of applause. Come on!
Good morning, everyone. Thank you very much for being here today. Okay, so to keep your attention, I'll have to ask you to excuse my puns as we take a deep dive into drowning prevention, resuscitation and recovery, and its relevance to children. I'm Kashfi. I work in the Children's Hospital, in Children's Intensive Care Unit at KKH. And today I want to talk a little bit about the problem, how serious and how bad are drowning injuries in children. I'll talk to you very briefly about the in-hospital care, and most importantly about the prevention strategies, because we all know and love some child, and what we can learn today can help that child be safe. We all know that children absolutely love to play with water. It brings them so much joy and so much laughter, yet in a single moment all of that can change. Mei, a 5-year-old girl, wanted to go for a swim while her mother was cooking dinner. She cried and insisted on going down to the pool, so her mom brought her down and asked her to wait at the side of the pool while her mother went upstairs to finish cooking. When her mother returned a few moments later, Mei was floating face down in the pool. There was a family barbecue next to the pool. It was a birthday party. Adam was 18 months old and playing on the floor just next to his parents' feet. So many eyes were watching him. Yet, the next moment, there was shouting from the pool area and someone was pulling him out from under the water. Laura was 2 years old and played with her mother at the edge of her pool while her siblings had their swimming lessons. Her mother was chatting with the swimming instructor, and as she turned around to look for Laura, she was already in the water. Her mother and the swimming instructor were right next to her. No one had even heard a sound of struggle. Drowning is the leading cause of injury-related deaths in children around the world, and it is true in Singapore as well. 56% of children who died from accidental injuries in Singapore died from drowning. Toddlers and young children are at greatest risk for drowning. 86% of those children who drowned were 7 years of age and below. This highlights that even when a child knows how to swim, maybe at 4, 5, or 6 years of age, they require constant supervision, and constant and attentive supervision is essential and extremely important to prevent drowning. Another group that remains at high risk are those in 15 to 19 years of age, and this is because of higher risk-taking behavior and a lack of additional knowledge in addition to just swimming that's required for them to be able to keep themselves safe and their swimming partner safe when they get into trouble. And similar to adults, substance use like alcohol increases the risk of drowning in adolescents and adults, and up to 10 times greater the risk of drowning when alcohol is involved compared to when it is not. Over a period of time from 2012 to 2022, when we look at our data, there was 343 child drowning cases, and these are cases that presented to KK Hospital. It is terrifying to see that between 2012 and 2017, the rates of drowning death doubled in Singapore. And thankfully, during COVID, during 2020 to 2022, due to lack of access to water, those numbers have come down. But we're not sure how those numbers will look like in the years now that we again have access to water and children are back. How serious are the drowning incidents? 6% resulted in deaths, and 20% required high acuity care. Of those children that survived, a smaller percentage also sustained severe brain damage. When children die from drowning, they often die from brain death, which happens through the period of lack of oxygen to the brain, as Andrea also shared. Some children who survive will have this irreversible brain injury. and they will no longer be the children they once were. So this reminds us that although the deaths from drowning is a smaller percentage, the number of incidents that occur are very large. And hence it's important for us to know how we can prevent it. Where do these drownings occur? There are 26 public pools in Singapore, and there are over 330,000 condos and private apartments in Singapore. Many of those have swimming pools. The majority of drowning deaths occur in private pools. 84% of drowning cases occurred in swimming pools. This is an increase over the years as well, but I'd like to draw your attention to the smaller numbers. 22 children drowned in a bathtub or a jacuzzi. 20 children died or drowned in the open sea. 9 children drowned in a bucket. 5 children drowned in a pond. And 1 small child drowned in the drain. So what happens when these children come to the hospital? Just to briefly mention, when drowning occurs, a person cannot breathe and there's lack of oxygen to all the vital organs. There's loss of consciousness due to lack of oxygen to the brain, and the heart stops due to lack of oxygen as well. And other organs like the liver, kidneys, gut, all of these can be damaged by the low oxygen state. So when a child comes or when an individual comes to the hospital, we try to return oxygen to all the body organs. And in addition to what has already been done by the paramedics at the scene, the CPR that has already been started, we continue that by giving oxygen through a breathing tube and ventilator, and management of the severe form of low oxygen that results from water in the lungs, management of the acute respiratory distress syndrome. From the cardiovascular point of view, CPR is continued. We manage the arrhythmias with medications and drugs, and fluids, and support the blood pressure with inotropes. Hypothermia, low temperature, less than 35 degrees, can sometimes be protective, but it also complicates and prevents the heart from functioning normally. And so correction of hypothermia is one of the important things that we have to look out for and perform in the hospital. And all of this is to allow the individual who drowned to have return of normal neurological function. So neuroprotection is really the biggest thing that we're trying to do here. Return adequate oxygen delivery, reduce brain metabolic demands to improve the chance of intact neurological survival. So, we know how dangerous it is, and we know that the best way to save a child from drowning is to prevent it from happening. With every tragedy, a parent will say, I wish I had known how to keep my child safe. And that's why I wanted to share this really important segment with you. Water safety begins at home. We must never leave a child alone in a bathtub or while playing in water. Small babies and children are heavy in the head. Their heads are very large. If they were to fall forward into a bathtub or bucket, they are unable to get themselves back out. They don't have the upper body strength or the presence of mind. And so they start to struggle and they further get submerged in the water. And children can drown in as little as a few inches of water. It takes less than a minute to drown. The time it may take for you to go and open the door for that bell that rang or answer the phone, you may have lost your child. So it's important to do these prevention things and be mindful of these dangers, and everyone in the household to also be mindful of these dangers, everyone who's looking after the child. Toilet lids and bathroom doors should be closed as well to prevent drowning. Active and constant supervision is the single most important thing to prevent drowning in children. A child can drown in the time that it takes to watch an average TikTok video. Children cannot be expected to keep themselves safe in the water. That is the responsibility of the adult who is watching them. And that could be a parent, any other caregiver, or lifeguard. Avoid distractions such as reading, talking to someone, talking on the phone while supervising children. And provide close, constant, and attentive supervision. So this means that if there's a child who does not know how to swim, or they're very young and can't be expected to save themselves if something bad were to happen, the supervision should be within reach. So you should be in the water, and you should be able to reach the person, the child, if they need help. For children that are avid swimmers and actually have the skill, the parent or adult who's supervising them can be at the side of the pool, but they need to be constantly watching. There also needs to be a heightened awareness of swimmers with pre-existing conditions like seizures, arrhythmias, and children with learning difficulties such as autism spectrum disorder, which may make it hard for them to not only assess the risk of danger, but also panic and be unable to get themselves out of there. And for seizures and arrhythmias, these paroxysmal events can be occurring for the first time in the water. And if they have already occurred before, there's that additional safety precaution that needs to be taken, that they should never be in the water alone. There should also be clear handoff of supervision responsibilities. If I'm meant to be watching my son, but I need to go somewhere, I need to give that responsibility to somebody else, and the person I'm giving that responsibility to should be able to accept and take that responsibility to watch the child. Basic swim skills are extremely important and reduce drowning incidents in children more than 1 year of age. And basic swim skills includes the ability to enter the water, to surface again, to propel themselves forward, float or tread water, and safely exit the water. Needless to say, even if a young child of 3 or 4 or 5 knows how to swim, they may not be able to perform all these steps that are necessary to keep themselves safe in the water. And that brings us to water competency, which is an added enhanced skill of being able to anticipate, avoid, and survive common drowning situations. And it includes the knowledge of local hazards, an assessment of risk, self-assessment of abilities, knowing what I can or cannot do, how I can or cannot keep myself safe, and also simple things like how to wear a life jacket, how to recognize and respond to another swimmer in distress, and also to perform safe rescue and CPR. Water competency is what really can save lives, and as I mentioned, more than just swimming skills. Additionally, can we create an environment that makes it impossible for drownings to occur? If the swimming pool is right next to the playground and children are playing in the playground, it's so easy for them to slip in and walk in. The water looks like it's at the same height as the ground, and children can't make that difference. So it doesn't, so rather than kind of allowing these incidents to occur, environmental safety is also a really important part of how drownings can be prevented for children. In some parts of the world, four-sided fencing that is at least 1.2 meters tall are legislated, and all private swimming pools have to have this. In Singapore, this is not the case, but this is an evidence-based intervention that will certainly prevent a child from falling into the water accidentally. Locked doors to restrict access to pool, and remembering to swim where lifeguards are present and swimming in safe conditions. Those are all parts of environmental safety. In Singapore, we'll have the launch of our Singapore standards on the 25th of January. And this is the Code of Practice for Water Safety for Aquatics Facilities and the Code of Practice for Inland and Open Water Sporting Activities. And at least with these documents, there are standards that for new swimming pools that are being built, or if you want to check and see whether your own condo is adhering to these standards, or your own swimming pool that your child goes to is adhering to these standards, this is a document that can be used. So if an event has already occurred, what really makes a difference during that event? A person who is drowning, if they have water competency and water survival skills, of course that makes a difference. Life jacket use in children and adults makes a difference. And the availability of rescue device, such as lifebuoys, and the access to emergency medical services. These are all things that can make a difference. But once an event has already occurred, what really makes a difference is early bystander CPR. In private pools, 61% of children were discovered by their family members, and only 34% received bystander CPR. And in public pools, 32% were discovered by family members, and 20% by lifeguards, and 42% received bystanders CPR. I'm the biggest fan of SCDF, and the incredible speed at which they dispatch, reach a site, resuscitate, evacuate, get them into the hospital, sometimes within 15 minutes, is really miraculous. And we've heard some tips from Andrea about what can be done by bystanders when they find a patient who has had a drowning incident. But the single most important thing, I think, is to restore oxygen supply. Being able to pull a drowning victim out of the water and start effective CPR will certainly make a difference. And so be confident and competent in your own ability to do CPR and encourage those around you to learn. Laura, who was 2 years old and fell into the pool unnoticed as her siblings had their swimming lesson, could not be saved. Her condition progressed to brain death, and her parents made the brave decision to donate her organs and give the gift of life while she lost hers. Once significant brain injury has occurred, it cannot recover or regenerate, but with supportive care, other organs in the body can recover. Let's not let this happen to any other child. Drowning is the leading cause of injury-related death in children. Drowning can happen in less than 2 inches of water. Drowning can occur in less than a minute. Drowning is silent. There is no substitute for active supervision. But drowning is preventable. So not all superheroes wear capes, and some, like you, wear Speedos or t-shirts or uniforms of other kinds. Thank you for your attention, and thank you for all the great responsibility that you take in keeping children safe in the water. Please stay safe, and remember that your life is as important as the one that you're trying to save. That's all I have for today.
Let's give a big hand, ladies and gentlemen. Thank you, Dr. Kashfi, for the insightful presentation.